Good morning, PT on ICE podcast. My name is Dr. Jessica Gingerich. I am with the pelvic crew, and today I'm going to talk to you about what do you do if your patient can't do a Kegel or a pelvic floor contraction. So this could be something that your patient is coming in with. They're having symptoms, whether that is leakage, heaviness, pain, anything, back pain, hip pain. You do your exam, you rule out other regions, so the back, the hip, and your conclusion is you want to start your plan of care by teaching them how to do a Kegel. But they don't get it. They can't figure it out, and this is with tactile cues, visual cues, even practice. Like you're just in there and you're practicing, you're saying, yes, you got it. No, that wasn't it. Now what? What do you do? So let's first define a Kegel. So a Kegel is the act of contracting the pelvic floor, but also relaxing the pelvic floor. So it's going to be both. If you've taken any of our online courses or our live course, we talk about that with the kind of like thinking about it as an attic and a basement. And so can your patient get to the attic? Can they get to the basement? This will likely, in a lot of people, initiate some strength improvement, strength gains. It also will improve spatial awareness. So do they know when they're in the attic? Do they know when they're in the basement? And are they able to say, oop, probably shouldn't be there in this moment? Doing a Kegel will also give a lot of people a sense of control. So when they feel like they're not in control of their bladder, or if they're feeling a lot of heaviness, especially after having a baby, they tend to kind of rip it and grip it because they want to feel like they're in control. Now, difficulties can include some physical limitations, right? So this is going to be like general weakness. Other things like pelvic pain or pelvic surgeries that may come along with pain or swelling are inhibitory, so it can make doing any type of contraction a little harder. And then we all have those patients, the generally uncoordinated person that exists, right? And that's okay. It's stuff that we can practice on. Also, mental blocks. So things like anxiety or stress. Or even lack of awareness. So this can come from poor education, growing up, or being encouraged to ignore that region, when you're young and then kind of going into adulthood. It can almost bring it where it's like it's not there, and therefore it's hard for us to do it. So whatever the reason is as to why we can't, or our patients can't do a Kegel, where do we go from here? Well, you ditch it. You ditch the Kegel. They're not doing it. They're not going to leave your office with the homework of doing Kegels when they could now start introducing poor motor patterns. So what we're going to do is we're going to introduce alternative exercises. So things like bridges, straight leg raise, bird dogs, and Copenhagen planks are a great place to start. These exercises will help improve the pelvic floor awareness by just improving the reflexive nature of the pelvic floor and also the co-contraction of the pelvic floor. Using diaphragmatic breathing, we talk about this a lot, and it's one of those things we're kind of like, diaphragmatic breathing, it's so boring, but it's really good, right? It brings, when you can teach someone how to do a good diaphragmatic breath, it's going to bring a passive range of motion to the pelvic floor. So that's going to improve range of motion. It's also going to allow a nice fluid pump and then also encourage blood flow to that area. So always teaching the diaphragmatic breath and watching them do it. Have them pull their shirt up where they're showing your belt or their belly, where you can watch their belly rise and fall. Is that happening, or are they getting it at their chest? So to recap what I talked about this morning, some people have a hard time with Kegels. If you're really good at them, you're kind of like, how do you not know how to do that? It's a region we don't really see. We don't really touch. A lot of people have a hard time with it. They will likely get frustrated. So if you are there and you keep harping on it, no, that's not right. No, that's not right. No, that's not right. They're going to get frustrated. You also may get frustrated. So move on. Utilizing co-contractions of the abs, the hips, and surrounding muscles to help recruit the pelvic floor is a wonderful place to start. Your hip rotators, extensors, flexors, your abs, obliques, side bending, isometrics, use all of those. In fact, writing a nice little EMOM, or excuse me, what I want to call is a REMOM from Mitch Babcock, have them perform that in the clinic. Do this 6 to 9 minute REMOM and then retest their Kegel, whether you do it internally, if you palpate it externally, or even if it's just self-aware, right? You have them lay down or sit down and you have them try to do that Kegel again with whatever cue that you like to use, and see if they know they're in the attic, or if they're like, nope, I still feel like it's not moving, or it's pushing down. You can even have them straddle something so they can feel, like whether it's a foam roller or a rolled up towel, where they can feel the pelvic floor rise and fall off on and off of that thing. And then at the end of the day, isolating the pelvic floor can be beneficial. We want to be able to do that, but harping on it may not be where they need to start, because everyone's journey looks a little different, and that's okay. So take this with you to the clinic today. If you are noticing that someone's having a hard time, ditch it. Just move on, and then you can always come back to it. So enjoy this. I hope you guys have a wonderful Monday, and we will see you next week.